Well, let's follow up on pharmacare and the federal government's COVID-19 response with three members of Parliament. Darren Fisher is a Nova Scotia MP and the Parliamentary Secretary to the Minister of Health. John Barlow is an Alberta Conservative MP and member of the Commons Health Committee. And Don Davies is a British Columbia MP and the health critic for the NDP. Good to see you all. Mr. Fisher, let me start with you all. We'll get to pharmacare and the debate around that in a moment. But first, let's talk a little bit about the federal government's vaccine plans and the COVID-19 response. And let me start with you. How come we're hearing today from the health minister in Ontario, Christine Elliott, announcing how many doses of the vaccine Canada is going to receive in January and how many Ontario is going to receive, but we aren't hearing any of these numbers or a rollout plan from the federal government on this? How come?
Well, thanks, Peter, for the question, and hi to John and hi to Don. We have done the work. We've negotiated numerous contracts with many potential candidate manufacturers and developers. The rollout will be, something that is done based on some of the things that we hear from the NACI, the National, the National Advisory Committee on Immunization. Right. They've provided some advanced guidance, but of course the guidance will determine how the rollout goes.
Right, but are they giving that guidance to Christine Elliott in Ontario? She seems to have the numbers, and she's already talking about how many doses Ontario is going to get. And some provinces are hearing these numbers and wondering, wait a minute, how's this being decided and what's going to come to my province, including yours in Nova Scotia?
Well, from day one, Peter, we've dealt with the provinces and the territories as equal partners, and we've worked with them very, very well, and that's not going to change. As far as a rollout goes, we're going to make sure that those who need it, those who are prioritized first, get it. There's still a lot of questions. I'm very optimistic about a vaccine coming up in the near future. But
do you know how many doses Canada is getting in January?
I do not know how many doses Canada is getting.
Christine Elliott says it's 4 million.
Again, we've got contracts with various manufacturers and developers of various vaccines, and we don't know which vaccine is going to enter the market first. What we'll make sure that we do is that we ensure that Canadians have a vaccine that is safe and efficient and effective for them.
All right, Mr. Barlow, what answers do you want from the federal government when it comes to how and when the vaccine will be distributed, how much Canada is going to get, and what the provinces are going to get, including your own province of Alberta?
Well, you touched on it in your question to my colleague. Is it 4 million? Is it 6? We've heard 6. We've heard 20. And to get this information from a provincial health minister and not from the prime minister or from the Liberal government, I find it completely disconcerting that. And even to Mr. Fisher, not knowing, he himself, the parliamentary secretary to the minister, doesn't know how many doses they're getting, but apparently an Ontario health minister knows. So who's telling the truth here, and why is there no transparency to us as parliamentarians on what exactly is going on? So I think what we need to see is a clear strategy on how the vaccines have been accessed, how many doses are going to be, how they're going to be distributed. And I know my colleagues and I have met with many stakeholders across the country, and pharmacists, for example, haven't been consulted. They don't know how many doses they're going to get or how it's going to be distributed. The messaging and the communications on this right from the beginning has been so inconsistent and so untransparent that I think that is where all this confusion is coming and this frustration from Canadians.
Mr. Davies, what's your view on how the government is handling the information around vaccine and when and which Canadians will get it?
Well, I asked that very question today in question period, Peter, that you asked to the Prime Minister. I asked, why is it that an Ontario health minister is telling the media that she's receiving 6 million doses of vaccine in between January and March, 4 million from Pfizer, 2 million from Moderna. She even knew how many were allocated for Ontario and the rest of the country. But the Prime Minister and Canada's health minister aren't telling Canadians. All I keep hearing from the Liberal government is they just keep telling us how transparent they are. Instead of telling us they're transparent, I'd like them to be transparent. And so far, they've been anything but. They refuse to release any of the details or contracts with the drug manufacturers, and other countries are doing that. Brazil just released almost the entire contract they had with AstraZeneca. And this allows the Prime Minister just to come and tell Canadians that he's negotiated the best agreement in the world, he says, but he won't actually give us the details so that we can judge for ourselves.
Okay.
And one thing I would just want to say is he keeps saying how many doses he's negotiated, but what we're hearing is that those contracts are for up to a certain number of million doses. And we also don't know when we're going to get them.
Yeah, I mean, there's lots of questions around
other countries.
Lots of questions about where, Mr. Fisher, let me have you jump in. Lots of questions about where, we talk about doses Canada's pre-purchased or pre-negotiated, but it's not clear where we are in the queue of that distribution system. So can you speak to that? I mean, how where's Canada in terms of the pecking order or the distribution order of who gets what when?
I would say, Peter, that we are either the most prepared country or one of the most prepared countries in the world for receiving future vaccines when the trials are finished, when vaccines are ready to seek Health Canada approval. We will have the backs of Canadians to ensure that they are safe.
Do you know where we are in the order of which countries get the vaccine first? We might be ready to receive it, but when?
Well, again, I mean, there isn't a vaccine that has been approved yet in the world. We're in the process. We're very optimistic. We're seeing really good information come forward. And we're seeing from companies coming forward that we have excellent deals with. So, there's a lot of questions still in when exactly we are optimistic. You hear people say a few months. You hear people say early in the new year. But it's important, Peter, that we don't give false information here. We know that things are looking optimistic, but it's very important to make sure that we measure that optimism.
Okay. What did you hear in that, Mr. Barlow, that puts your concerns at ease?
Well, my concerns haven't been put at ease with that answer. In fact, they've been heightened. The fact that how can he say that we're amongst the most prepared countries in the world when the number of doses they can't answer, or we could be 4 million, we could be 20. We don't know that. We even have rapid tests that have been developed here in Canada that have been approved by other countries. Canadian companies using rapid test technology developed here in Canada in other countries that they can't even get approved here in our own backyard. So for the parliamentary secretary to say that we're the most prepared country in the world, but he can't answer any of these questions, I find to be very misleading. You can't possibly be the most prepared if you don't know any of these answers that we're trying to get. Okay, let's see how prepared we are in pharmacare. Mr. Davies, let me move to you on that. Your party introduced a private member's bill today to introduce a national pharmacare plan. Universal single-payer plan. What's really behind this? Is this to prod the Liberals into following through on their pledge to create a universal plan? Or is there room to work here? Or are you just trying to see if you can prod them into moving based on this bill?
Well, it's a historic day in Canada as far as I'm concerned. We introduced Bill C-213, the Canada's Pharmacare Act. And really what we've done is we've done the work and acted to produce the legislative framework to provide universal public pharmacare, which the Liberals have continually said they support but don't actually do anything about. So much like in the mid-1960s, the NDP had to basically prod the federal Liberal government in a minority into providing Medicare. We're doing the same thing now.
Right, but it's a private member. It's a private member's bill, and it'll be debated over the next 3 months or so before it has to come to a vote in principle, sometime probably in February. So there's time to debate this, and I mean, there's no guarantee we wouldn't have an election before that. So, how sure of a thing is this in terms of trying to push policy forward for Canadians?
Geez, well, I've been in federal politics long enough to know there's no sure thing. But look, it's a private member's bill, but it's legislation, and it's coming up for debate and a vote.
Okay.
And the government is free to support it. I hope they do support it because it's exactly what they claim to support, and it's modeled on the Canada Health Act. We can cover every single Canadian's pharmaceutical needs and save $4 billion a year.
Let me hear from Mr.
What's not to like?
Mr. Fisher, what's not to like? Here's your chance to. Your party's talked about a promise of universal single-payer health care. Here's your chance. Pharmacare. Yeah. Here's your chance.
I'm a huge supporter of national pharmacare, universal national pharmacare. And, I don't see us imposing our will on the provinces. We have worked really hard during COVID-19 to build relationships with the provinces and territories. And I think we need to continue to build on that when we work with our partners, our equal partners, to come up with a great plan for universal national pharmacare. I think we're going to get there, but sometimes I think, in all due respect to the NDP, they think it's as easy as ordering a chocolate shake at McDonald's. It's not. We can't impose this on our partners. We must work with them. We must see what their sides of the story are. this is something that
Okay.
we Canadians deserve for us to get this right.
Mr. Barlow, let me hear you on this. The part of this bill, the NDP bill, I think it's 213, would withhold money from provinces who don't meet standards set by the federal government for a national pharmacare plan. If so, they wouldn't, in other words, be given money to do their own thing. If it's not the federal plan, they're penalized. They don't get the cash. So, is this a non-starter for Conservatives?
I think our focus has to be on the fact that every Canadian should have access to prescription drugs. No Canadian should be going without their medications. But we also know that at present, only 2% of Canadians don't have access to prescription drug coverage. So our focus should be on having a program that ensures that 2% gets access to the prescription medications that they need, while still protecting those programs that are in place that ensures that 98% of Canadians get good, solid medical coverage. And I think that is where our focus needs.
We'll have to leave it there. Going to be lots of time to debate this and return to the conversation. But thank you all for your time tonight, gentlemen. Appreciate it.
Thanks, guys.
For having me.
Thank you.
Good to see everybody.